Have you ever wondered what is truly normal for your unique body, especially when it comes to something as important as breast health? Understanding your own body is a powerful way to stay proactive about your well-being. Identifying your normal breast tissue really comes down to knowing your unique breast landscape through regular self-examination. It is about understanding what feels typical for your breasts, allowing you to notice if anything changes over time. The reason this is so personal is that breast tissue varies greatly from one person to another. Factors like age, hormonal fluctuations, and genetics all play a role in how your breasts look and feel. What is normal for your friend might be completely different from what is normal for you, and that is perfectly okay. The goal is not to compare yourself to others, but to become an expert on your own body, so you can detect any unusual changes promptly. So how do you get to know your breasts? It involves both looking and feeling. First, visually inspect your breasts in front of a mirror with your hands at your sides, then raised overhead, and finally with your hands pressed on your hips. Look for any changes in size, shape, or symmetry. Notice any dimpling, redness, scaling, or nipple changes like inversion or discharge. Next, physically examine your breasts. Many women find it helpful to do this while lying down, as it spreads out the breast tissue, or in the shower, as soapy hands glide easily over the skin. Use the pads of your 3 middle fingers and apply different levels of pressure. Light pressure for the tissue closest to the skin, medium pressure for deeper tissue, and firm pressure for the tissue closest to the chest wall. Systematically cover your entire breast area, from your collarbone down to your rib cage, and from your armpit across to your breastbone. You can use a circular motion, an up and down pattern, or a wedge pattern. Just be sure to cover the whole area. When you are examining, you are feeling for any lumps, thickenings, or areas that feel distinctly different from the surrounding tissue. You might also notice pain or tenderness that is new or unusual for you. Remember to check both breasts and your armpit area too. The best time to do this, especially if you are premenopausal, is about a week after your period starts, when hormonal changes are at their lowest and your breasts are less likely to be tender or swollen. An interesting detail about breast tissue is the concept of dense breasts. This is a common finding where breasts have more glandular and fibrous tissue and less fatty tissue. Dense breasts can feel lumpier or more uneven during self-examination and can sometimes make mammograms a bit trickier to interpret. However, regularly feeling your own breasts still provides valuable information about what is normal for you asterisk, even with dense tissue. Understanding your normal breast tissue and noticing any changes is a critical component of your overall breast health strategy. This personal knowledge, combined with regular clinical breast exams by your doctor and recommended mammograms, creates a powerful approach to early detection. It empowers you to be an active participant in your health journey, ensuring that if any changes do occur, you can bring them to your doctor's attention right away.